The first theme that I talk about is just looking at further tailoring, looking at reducing the dose and reducing the fields. So, we talked a little bit about hypofractionation and we talked about partial breast irradiation therapy, but we have a lot of trials now that are really trying to refine, when is it safe and appropriate and which patients can we further kind of tailor those recommendations for. So I just dubbed that theme, reducing radiation dose and reducing radiation fields. And then the second theme that I have is just looking at which patients can omit radiation altogether. So we already have a defined subset of low-risk patients who may not need radiation therapy after lumpectomy. Those are women who are over 70 years of age and have low-risk features. But the next decade is really looking at, can we identify even younger patients who have equally low risk of recurrence? How do we find those women? What types of tests do we need to do to figure out who they are? And then looking at doing lumpectomy not followed by radiation, but just no further local therapy. So trying to call out other patients that might not need the radiation altogether. And then the third theme that I have is looking at the response to preoperative systemic therapies to guide radiation decisions. So I talked about the fact that in the early studies, we said that for post-mastectomy radiation, for example, any woman with positive lymph nodes or a certain number of positive lymph nodes should receive radiation. But we now have study questions looking at, if you start off with lymph node positive disease, but you have a very good response to preoperative systemic therapy, can we omit post-mastectomy radiation or omit regional lymph node radiation? So can the response to chemo help us, tailor decisions in that setting? And then the last theme that I have is about technology and ways we use technology to reduce morbidity in breast cancer radiation, and specifically talking a little bit about protons, which I think everybody is very excited about in radiation oncology.